to this webinar. Today, we are going to have a very special session talking about how we can bring AI and automation to external audit management. It's kind of a big title, but really what that means today is we're going to walk you through how both artificial intelligence in ways to automate when you have to respond back to those external audits that are kind of showing up at your back door. So welcome. Really happy to be speaking with you today. Just a little introduction here. My name's Dana Finnegan. I'm the Director of Market Strategy at MD Audit. MD Audit is who's sponsoring this webinar today. A couple of housekeeping items before we move on is the deck that we're going to show you today, that we're going to go through today, the PowerPoint, that will be sent out to you at the end of this session or within a couple of days. We're also going to be sending this recording. I think more importantly than that, we are going to be sending you home with some nuggets of intelligence and intel that will help you really manage your external audits in a better way, more efficient way. We're also going to tell you a little bit about what we see being externally audited the most in our MD audit community. And one last thing is there's going to be a survey at the end. And that's going to just really ask you about any future topics you may want us to present on. So feel free to provide that feedback, as we're always looking to deliver what you're looking for. So let's start. We're going to start a little bit off about MD Audit. So who is MD Audit? Just really quickly, we work with hundreds of clients across the country, well over 150 health systems and community hospitals, large academics, everybody kind of in that strata across the country. We have over 30 years of experience in billing compliance and revenue integrity. And at the end of the day, what we do is we use our subject matter expertise to help these organizations ensure that they're maintaining the highest levels of accuracy and integrity with their billing from a compliance standpoint, but also maximizing revenues. So we're going to be referring to some data that we're seeing in our MD audit community. So we just wanted to give you a little familiarity with who we are. So I think this is why we decided to do this demonstration today, this webinar today, which will have a kind of demonstration piece as well. It's always good to be able to visualize what we're talking about. But from the MD audit community, again, 150 strong across the country, in the last 6 months, we asked them what their experience was with external audit volume. And you can see right away, the large majority, almost 70%, said that they saw a pretty high increase in external audits, whether they're coming from RACs, SMRC, TPE, UPIC, whatever it may be. There was a 67% increase. I think that the stat that's stuck out to me more than the 67% increase was the I don't know. Now, that doesn't say anything about our customers and folks not necessarily knowing, but what that means a little bit more is these letters, these ADRs are going all over the place to, different facilities, different departments. So that 18% is working really hard to understand and how to optimize their process so they know exactly when those letters come in, where to route them, and how to optimize response times back. So I think that what I'm saying there is if you add the increasing and the I don't know, it's a very large group of folks that are needing our help in getting them to maximize outcomes with these external audits. I'm sure the folks out there today are part of that increasing piece of the pie. So that's why we're having this today, is we want to show you that as crazy as that process can be in receiving those letters and have to respond immediately, there is a way to streamline that operation. So I wanted to talk about this. This is just a quick slide. Now that $25 billion in Medicare fee-for-service improper payments Right before the webinar, and I apologize for this, I saw that that was a 2021 statistic. So I'll update this. It's now moved to $31.6 billion in that's a stat from 2022, $36.1 billion in improper payments. So really what that means is that not only will you see a lot of claim denials, but you're going to need to have a really good workflow to respond back, because you can see 64% of that is them looking for more documentation. So at the end of the day, you're going to have a lot of need to use what we have, which is electronic submission of medical documentation, in very strong document management, where you can store all of your documents and appeals letters and medical documentation to be able to send it directly back, not only to Medicare, but to your commercial payers, et cetera. So at the end of the day, that improper payment statistic has just gone up to 31, almost 32 billion. So you're going to see a lot of these ADRs coming to you, asking you for more documentation, and you need to be ready for that scrutiny. So I want to talk a little bit about what is an external audit workflow. What does it have to have bare bones in order for you to maximize your outcomes? When I say maximize outcomes, I mean how you can really decrease what you're refunding and really increase what you're retaining. We don't want these different payers, government and commercials, to kind of win that battle just because you might not have a holistic process in place. So I think some of the main places where there needs to be strength starts with document management. So is there a place at your organization that's very easily accessible to throw in the determination letter, the ADR, we should say, where does that go? The demand letter, then the determination letter, all of the medical records, all of the appeals documentation. Is there a place that stores all of that? And is it easily accessible to many different stakeholders in your organization? That's key. ESMD is equally important, if not more important. You may have a place that stores all that documentation, but do you have a way to electronically submit it back to those external requesters, the ones that can't accept it that way? So you're not spending time and money on faxing and printing and stamps and all of that. So document management and ESMD, you can see overlap. Another really important piece of that is task management. We're going to show you that because it's a concept you really have to see. But anytime you use a platform to help you with your external audits, you need strong task management, meaning, is there configuration available that as soon as that letter shows up at the back door, people can be alerted to what they need to do as an individual stakeholder to optimize outcomes again. So if I'm sitting in HIM, when that letter comes in, do I receive a task telling me I need to send medical records? Or maybe I'm on the front end, I get a task saying you need to upload this demand letter, and so on and so on. If there isn't configurable task management to what works within your organization and the players that are involved, it can be a very disjointed process. And essentially that's what payers want, is a disjointed, disconnected process, because then it will really kind of not allow you to respond in a timely fashion. And then this often gets overlooked, I think, the reporting and analytics, because a lot of folks will say, well, I've got all these processes in place and I'm getting back to these external requesters in time. But then when there needs to be some tracking and trending over time about how much are we retaining, how much are we refunding, why are we being targeted, who's targeting us, what DRGs, what CPTs, what facilities, there's no way to aggregate all of your efforts and say, this is how we're doing. That there's no reporting and analytics. So these are all intertwined, because you can't really be successful with just one or just two or just three. You need all four of these to really put up a good fight when you're responding to the influx of these external audits. Now, we're not going to go through all of these because we just talked about task tracking and documentation and reporting and outcomes. But I'm going to stop here and talk about optimizing organizational processes. So one of the most important things you're going to want from a vendor, and again, I'm not here to push MD Audit's solution on you. We're here to say there's vendors out here that do this. We feel we do it the best because we offer all of these things, but we want to give you some nuggets of what you really need in a software. So along with everything else we just talked about, most importantly is you need configurable workflows. We talked about that a little bit with task management. Every organization, if I talk to 20 different clients, there's 20 different ways that organization handles external audits. So you need a vendor that can give you a lot of configuration out of the box, best practices and how to deal with these. But you also need to be able to put your own tweak on that, because essentially you have that institutional knowledge of the best ways to respond. Another really important one is enabling communication across the organization within one platform. Let me just boil that down. You need a platform where everybody that touches the external audits, everybody that touches those external audits can jump onto the platform and do their piece of it. Doesn't mean they need to live in that platform all the time. Maybe they're not, maybe they're just the person that's providing medical records or doing certain things, but everybody needs to be able to communicate within the platform to say, I've finished my task, here's your task, and do that handoff and have visibility as well into who's done what, when they did it, is that task going past due. So you want something that's not only configurable, but that will essentially engender cross-departmental collaboration. Because if you're putting up a united front as an organization and everybody can get their task done and talk to each other, you're going to beat the payers when they start sending you these ADRs and looking to claw back money. And the last thing I'm going to say, and I'm going to show you this in the demo, a quick demonstration that we're going to do is integration of internal audits and external audits. What that means is you need a platform that when you receive an external audit, great, you can manage it, do everything you need to do, but you should also be able to send that external audit to an internal auditing body within your organization, because you're essentially getting that letter and it's saying, look, at the end of the day, we want these medical records because we're gonna probably do some takebacks. You want to be able to send that over the fence immediately to the internal auditing and code and compliance folks so they can take a look at those accounts and say, do we have a leg to stand on? Are these coded with the highest level of accuracy and integrity? Should we appeal these? So that is a huge piece as well. So we're going to be sending this out. There's a lot more data behind this, but that is something that is absolutely key, is a platform that understands many hands touch this process and that those hands can be kind of brought together for a handshake to make sure everything is happening the way it should. I'm going to talk about one more piece of our solution that is super important, and you're going to see it in action. It's artificial intelligence via what we call SmartScan AI. And what SmartScan AI does, and you're going to see this in action, is when that ADR comes, the biggest pain point at the beginning of that process is someone has to take that ADR, and it could be 25 pages long with hundreds of accounts on it. Many organizations are taking that and entering it manually. That's taking an entire afternoon. And then there's a lot of data entry mistakes, kind of fat fingering some of that stuff in there. So there's a lot of issues that can happen when just getting that letter and then needing to enter it manually. So what SmartScan AI does, and we're going to show you this today, is it allows you to take that letter, that ADR, just really hit an easy button and have it scanned automatically for you. And what it will do is take that 10 pages, 20 pages, 30 pages of hundreds of accounts and do all of that entry for you. You'll see it in action, because I know it sounds probably kind of too good to be true, but starting off right is the most important piece. If you're able to get the letter in, not have to spend, hours and days in that data entry, you automatically gain traction for all the other important things you need to do to get back to that payer and again, fight that good fight. So this here it is key. And again, we're going to show you how that works in action. So one thing, we don't have to worry so much about the stats up top here, but one of the things and key trends that we're finding in our community is the fact that for just external audits in general have quadrupled in 2023. That's obviously a comparison to 2022. So we saw that rise in external audits post-pandemic when those leniencies kind of went away. And now in 2023, we've seen that actually quadruple in our user community. Customers are also telling us that the letters are getting longer. And that's what I said. You know, I have an example that I'm going to show you today that's 6 pages and how we scan that through SmartScan AI. But some of these letters can be 10, 15, 20 pages with hundreds of requests on them for very high at-risk dollars. So SmartScan AI really improves the accuracy of getting that data in the system, so there's no hiccups in going forward. And that's just some stats on how much our SmartScan AI has been used to defend at-risk dollars in the last 12 months. So really heavily being utilized by our community and really yielding some very positive results. This here is something that I won't go through in total, but I want your eyes to focus down where it says inpatient focus and outpatient focus. I'm going to read to you while you're kind of looking at that, but we did a very in-depth study amongst our community of what was being targeted externally. Now, the external audits, again, this could come from RAC, MAC, TPE, all of those, SMRC, UPIC, but also commercial payers, Medicaids. And really the inpatient focus that we saw over a 12-month period as this quadrupled, as we had said, was high-cost DRG treatments. And they were specifically ones related to sepsis, particularly ones with those events over 96 hours, major head and neck procedures, and ENT procedures. So those were the things that we saw on the inpatient side where we were our clients were receiving the most amount of scrutiny. On the outpatient side, it was a lot of DME, specifically related to cardiac and neurological ailments, spinal cord procedures, and then we also cancer drugs and kidney treatments. So that's really where there was a lot of focus there on the outpatient side. And the reasons for scrutiny were very, very standard across the board for all of those, inpatient and outpatient, which was questioning the severity of illness. Did the actual cost support the severity of illness? Medical necessity, cost outliers, diagnosis, complex diagnosis codes, HCCs, CCs, and MCCs being questioned, and treatment protocols. Treatment protocols was something that was really fascinating to me because really what the external auditors were doing was, for example, a spinal cord implant that was purely showing that patient had better outcomes, was feeling healthier, had more mobility. But it was being externally audited because payers, many different payers, were saying, look, that may be working, but I need from you the documentation of why other treatment methodologies failed, and you need to go to the actual implant. So a lot of those things are maybe working, patient outcomes are good, but they're going to bump up against payer policy, and they're going to come and externally audit you. So this, I think, is one of the nuggets that we want to provide you with before we go into a demonstration to show you how this all works. Because if you can take this inpatient focus, outpatient focus, run some data on it, I'm pretty darn sure you're going to see that you've been externally audited for these same types of services. And maybe you can even put some of these on a prospective audit to ensure that things are going out accurately so you avoid those external audits. So I want to talk about we have many outcomes, but we're not going to spend too much time there today. But I put this one up here. I blinded the client. But one of the things that I think was most interesting is this was showing a client that had implemented our external audit workflow, and within 6 months, which is a quick period of time because there's change management, there's a lot of learning. So 6 months at the end of the day is a pretty quick period of time from pressing the button and starting to use the external audit workflow. But up to almost 100% of at-risk dollars were retained. So of all of the different racks, max, TPE, all of that was at risk, almost 100% retained. The other part that I thought was really cool, besides just the 6 months period, was that 94% of that was resolved and retained in round one. As we know, there's several different rounds. If you can get that resolved in round one, because you have the right technology, then you're able to put your resources to other more valuable things instead of, this chaotic process that can sometimes happen. Provider education, coder education, other things that need to be done if you can not have to go into subsequent rounds. And round two, about 6%. So at the end of the day, we're seeing a lot of case studies in our client community where they're able to retain most of the at-risk dollars in a very quick fashion so they can move on to bigger and better things or put out other fires that are going on. So what I want to do right now is go into a quick technology demonstration of our external audit workflow. I do want to also say I've highlighted external audit workflow because if you would like to talk to us more about other things we do, we also have internal auditing workflows. And let me just kind of explain that really quick before we get into the demonstration. Internal auditing workflows is so you internally can audit your physicians and coders and high-risk DRGs and all of that. External is obviously when the external audits come in. We offer both, and we also offer synergies between those two, which we talked about a moment ago as being so important to have all the stakeholders internally doing audits and those handling external audits can talk to each other. But there's other modules as well, very analytical modules where we can actually point out your aberrative billing patterns through benchmarking and other capabilities, AI, sophisticated analytics. So we're showing you a very small sliver today of our external audit workflow, but there's a lot more we can do to help you. And we're happy to talk with you post webinar today. So what I'm going to do today is go into the platform right now, and hopefully it hasn't signed me out. Oh, I'm going to continue. So what we're going to do right now is show you in the next, I'd say about 20 minutes, and then we're going to answer some questions. I should have mentioned that before, but if you have any questions about anything we're doing today, put them in the chat. We're going to address them after the demonstration. But what we're going to do today is show you exactly everything we just talked about, how it can work on a platform in, again, just a few clicks. So right now, what you're looking at is the MD Audit platform. And this blue section, we won't spend too much time here, but this is where I'm able to go in and do internal audits of my physicians and coders, whatever it may be. But we're going to concentrate here today on the green section of our platform, which is for external audits. But the reason why I bring that up is whenever you're looking at a platform, they should have synergies between internal and external auditing. I'm going to show you how that works. Now, the first thing we're going to do is go into what we call process templates. This is at the very heart of everything that you're going to see today. So process templates is actually synonymous with what we think to be automated task management. So you're going to see here, CERT, RAC, SMRC, TPE, UPIC, all those names that we're kind of don't want to hear about, but are sending us those letters. I'm going to go into the RAC one here and show you what I mean by task management and how we can automate that. So you'll see here, I have my RAC audit that came to the back door, but I have an initial submission round, an appeal level 1 round, QIC appeal level 2, and so on. But what task management does is it will say, what are the best practices? What should the flow be when that letter comes? And the first thing is I should upload the demand letter within 1 day. I should then request the medical records within 5 days. I should then review them for accuracy and completeness in 10 days. And at the very latest, I should, within 30 days, submit those medical records. And then again, I should review for determination. I should do refunds, rebills. This whole process that you're seeing here, this is not just a flow chart that lives in the background. You're going to see when we create an external audit together, these tasks are going to fly out to everybody that's responsible for doing them. And I'm going to show you that in action, but this is what we meant by when I said configurable workflows. When you create an external audit based on the receipt of that ADR, You need a platform that can start sending these tasks out to people and letting them know what they need to do and when they need to do it by. And if that's available, you will not miss another deadline and you will organically retain more cash. So we're going to show you that, but this is a very important understanding of everything we're going to show today. Now, we start you off out of the box with what's on the left. You can even go into that RAC process and tweak it to the way your organization responds to a RAC. What you're not seeing are things like Blue Cross Blue Shield or your local Medicaid. That doesn't mean it doesn't exist. You can go in and create your own process templates and task management for those respective payers because you are the expert. You know those payers better than we do. But we do start you out of the box with some really good task management. So let's go in right now and do this together. We're not going to do a full RAC audit here, but I want you to see some of those core capabilities we talked about. Now, before I do anything here, I do want to show you, I do have a ADR letter that was sent by a QIO. We all know the quality improvement organizations. It's 7 pages long with about 20 accounts on it. I'm showing you this. There's no PHI. It's all blinded. But I'm showing you this because I want you to I'm going to show you how SmartScan AI works and can completely eliminate any manual entry. So let's set up our audit. I'm going to say a RAC audit came in. I'm just putting in my title. I'm then going to choose a group. Now, I'm going to go through this quick, but groups are important. I'm going to say that I'm working with the external audit group, but our platform, just as an FYI, can allow many, many different groups to work on our platform at the same time. Again, you may be just doing internal audits. Someone else may be doing external audits. Someone may be working revenue integrity denials. Everybody can work on our platform in a very harmonious way and not get in each other's ways. So I've simply put in my title, my group, and I am going to choose now RAC audit. This process is exactly what we just looked at, those process templates. I'm going to choose the RAC audit one. And then when I choose it, it's going to start throwing those tasks at everybody just by choosing RAC audit. Now, one other thing I should have mentioned is in addition to the process, I'm also going to put in the notification date. So today's the 26th. I'm going to say I really slacked on this one. I was notified on the 10th. Now, when I say the notification date, that's the date on top of that QIO letter that I got saying this is the 10th. So again, once I hit process and put in RAC, and the notification date, at that point, folks, tasks have already gone out to people. And I'm going to show you that in a moment. So I'm just going to do one last thing here. I'm going to put in my dates of service for what was on this letter. And I am going to hit continue. So really what we did there was we just set up a shell to say we received this RAC letter, this demand letter, and now we're responding to it. So we've set up the shell. You can see that right here, RAC audit. And now is where kind of that magic happens. So I'm going to go in and put a claim type. It can be, this works on both the pro fee side and the hospital side. We're going to do hospital today, but scan request letter. So I'm going to click here and I am going to browse for that letter that was on my desktop. And let's go and find it. And here it is. And I am going to hit scan. And I want you to see how fast this goes. So hit scan. It's scanning that letter. It's using AI and optical character recognition. In that fast, just in that millisecond, it has found all of those cases. So what it did is it looked at that PDF, and instead of a resource spending days or hours entering all of this information you see here, primary diagnosis, CPT, MRN, all of this stuff, patient first name, last name, etc., it's all done through SmartScan AI. This piece is really a lifesaver, and again, getting you off on the right foot. So I'm going to add those cases to my audit. And I'm going to just save my audit. And now what you're seeing here is immediately through that SmartScan AI, it's loaded. It's told me I'm in the initial submission round with the RAC, and it's loaded all of this information. And this information is super important. It's again showing me everything. It's also showing me the total charges for those accounts. It's also showing me the payments that were made. And this payment information is incredibly important because I could sort this from highest to lowest dollar and make strategic financial decisions on what I'm going to appeal and what I'm not going to appeal. So again, I know I'm kind of beating the dead horse here, but by that Smart Scan AI and using artificial intelligence, that gets you and eliminates any manual entry that you would have to do. And also document management. Let's look there. That has already, through the scan, put that ADR letter in document management. This is the same place that you can go in and put wherever it lives, medical records, appeals documentation, the determination letter. So along with that Smart Scan AI, you're getting some really great document management. And that's important because you're going to be able to, in our platform, submit that documentation back to the external requester through ESMD. So let's go back to our case list and show you what else we can offer here. So let's go to tasks. I promised you that tasks would be thrown at the people responsible for doing them. Now, I'm the only one handling this audit right now, but you can see it's already showing me that I'm past due on uploading that demand letter. I should have done that October 11th. And then I also have to request the medical records by October 15th. I know that time's passed. We're just in a demonstration environment. But I know I have time this week to kind of catch up because I don't have to submit those medical records until November 9th. So this went to me, but these tasks can be configured to go to the people that are responsible for doing them. They don't even have to be accessing our platform. So if you're just, again, I keep on saying that, the person that may be in medical records or a person that's in a certain department that's just doing certain things, uploading the demand letter, doing corrections, you can all get a task. And if you're not directly accessing the platform, it can go to your organizational email and it'll look just like this. And I can even go in and execute on these. Now, I know I've uploaded the demand letter, but let's just show you. I've gone into this task, can actually execute this task from right here. So I'm going to say, putting in that letter, I'm going to hit save and I'm done. I'm going to save and close that. It's attached it for me. I can click this and it's gone. It goes into my completed column. So again, having task management for everybody that's touching these is incredibly important. So we've talked about document management. We've talked about Smart Scan AI. We've talked about tasks. Let's go in and actually show what we're going to do with these accounts. So again, these are my accounts that have come off that letter. One other thing you should be able to do is this, add to an internal audit. So we talked about this. You must be able to take what comes externally audited and pass that along to folks in your internal audit departments. And I can do that by just clicking here and add to an internal audit. What that's done, folks, is I was here, but I've now sent it to the, I'm going to say the blue part of the platform where I can go in and say, hey, I'm going to assign this to Kathy. I'm going to hit continue. I've sent Kathy those 7 accounts that need to have that internal coding quality review. I hit continue and I create an audit that sends it to Kathy. She's going to have all the information she needs at her fingertips to really come back to me in the external audit side of the fence and say, yep, we're going to stand behind these. They're coded appropriately. Here's the supporting documentation, all of that. So again, we talked about synergies between the two. You must be able to go back and forth. This is what we talk about, a platform that can engender synergies and collaboration between many different departments, many different stakeholders, breaking down those silos. So let's go in now. Let's assume some time has passed and we've gotten a determination letter. You know, we're not going to wait for everything. That takes time, but we're going to assume we got the ADR, we got our appeals documentation, we sent back the documentation. There's been some communication. So now I'm going to go in and tag these claims because you're going to want to be able to tag these. Are you retaining? Are you refunding? So I'm going to go in and view this case and show you how you can do that, how easy it is. So It's now brought me to this case, this account. It's going to give me my MRN, my account number, patient name. But I'm going to go in and put the at-risk dollars. I'm going to click that dollar sign, and it's going to bring me right to the billing history. I'm able to look at the claim that went out, the remit that was cut, and I'm going to apply that paid amount, because that's essentially, folks, what's at risk. Now, that's only $25. We're in a demonstration environment, no PHI, no real data. That could be $250,000. So dollars are small, but this will work for very large dollar amounts as well, inpatient, outpatient, prophy. So I put in my at-risk dollars. Now, the next thing I'm going to do is put in an outcome. So I'm in round one again. I'm in the initial submission round. What was the outcome? For this one, we're going to say approved. We'll show one that was denied. But these drop downs, folks, are actually customizable. You can add your own verbiage here. I'm just going to say approved. And I've now approved it. So the status of this claim, it's not in progress. It's not pending determination. It doesn't need to go to corrections. I'm done. This was a good outcome. So I'm completed. And my final outcome is approved. Now, I want to show you something. There's an at-risk field, but there's also a retained field and a refunded field. Watch what happens when I hit save. It automatically moves those risk dollars to retained, because the system knows if it's been approved, it should go into retained column, not refunded. So again, just saving you another step. But when I'm done, I can save that, and I'm going to click here. And now I can go across and see that that claim is completed, and total charges were $133. Payment was $25. I didn't have to refund anything. And it is approved in the first initial submission round. So tracking everything you do. We're going to do one more, just for repetition, helps you kind of see what we would do here again. And I'm going to take this account, and I'm going to go into the at-risk dollars again. And again, it brings me right to the remit, so I can apply that payment. This time, I'm going to say that the round outcome was denied, will appeal. Now, we're not going to appeal it today, so we don't have a lot of time together, but if I want to appeal it, I can just advance to the next round. System takes all the claims that you hit with will appeal to the next round. Today, we're just going to say will not appeal. Now, what I'm going to do is put in a denial reason. It's really important to put in a denial reason. I've got against payer policy, but these are configurable, so you'll really have a great way to track why you're being denied or why you're being successful. I can even put in notes that'll be great to report on as to why I've been successful or not. Learn from that. So I'm not going to appeal it. I'm not going to move to the next round. So I'm again going to put that I'm completed. And unfortunately, I've been denied. And again, when I hit save, let's watch that $234. It has automatically put it into the refunded column. So now I can close out of this. And very easy for me to go across here and see I've completed 2 accounts. In the initial submission, one was approved, no refund. One was denied. I decided not to appeal it, so I'm going to have to refund $234, and so on. And you can do that for all of those other accounts that are from this original demand letter. So really, to take a step back, folks, you need to have that strong document management with SmartScan AI, that ability to send things back through ESMD. You need a case list that's easily, you can easily navigate and tag with what has happened. We talked about tasks. Tasks, very important to keep everybody on task. Now, what I'm going to do right now is show you one other part of this and because I get asked this all the time. These are the tasks that are applicable to this individual rack audit. But we know many of you are handling many, many different external audits at the same time. We're not all as lucky to just have one at our back door. So I actually have a part of the platform where I can go and hit and see my tasks. My tasks are those things that are past due this week, and upcoming for all of my different external audits that may be going on. And I'm going to put it in a group task view because it's a little bit easier to see. But it's very easy for me to come in, and I've named all of my external audits rack audit, but this could be rack audit, this could be SMRC, this could be TPE. Point being, I'm able to go in and see for this rack audit, I need to do these things. And for this, oh, right there, SMRC audit, I need to do this thing. And you can do it right from here. So there's always going to be not only the tasks that are applicable to that one external audit, but you'll have a nice vantage point of everything you need to do for all of your external audits through this My Tasks dashboard. And the manager, the CCO, or wherever it may be, has a task headquarters. This is incredibly important, folks, because what this is showing is here's all the tasks that are in flight. Someone can go down here and see here's all the things that need to be done to respond to those external audits. And here's who they're assigned to, bunch to Dana, bunch to Joe. But that's a good way to see that the due date's upcoming. So you can manage what's going on, ensure that things are getting done. But more importantly, you can go in and see tasks past due. Come in and see, okay, a lot of this stuff is coming past due. I need to maybe take some of that stuff on Dana's plate and give it to Nancy. So it's allowing you to have, again, a holistic view as a manager or above to say, are things getting done on time? If not, resource allocation, Dana's got too much, I'm going to give some to Joe, etc. So again, vendors should also, a software should also give you those viewpoints you need to understand what's going on and ensure that it's not going past filing deadlines. So we've talked about a lot of things today. I'm going to end now with some of the reporting. So the reporting is probably as important to everything we've just shown you right now, because what reporting does is it allows you to go in and see what has happened. So we have a section of our platform called Audit Insights, and it's AI at work that's running intelligence over your external audit activity, whether you've done 2 external audits or 2,000. And it's giving you things like who's requesting it of you, what's being targeted, and other things. So let's go into the requester summary. Now, again, these are data visualizations that as soon as you start responding to external audits, will just populate. You do not have to build these. I'm going to show you how you can build your own. But for example, here's my at-risk dollars by requester over the last 12 months. Able to go in and look at this and see everybody that's externally requesting of me. But it's very easy to come in and see that, wow, the lion's share is coming from this external auditor. Then I may want to drill down and say, I've got a ton of facilities. Where are these going to? Who's getting externally audited the most? And I can say, of my 2 facilities or 20 facilities, it's this one. Then I may want to go further and say, okay, being externally audited by Cotiviti at this organization. I may then want to say, what DRGs are being targeted? And it's going to get me down to the DRGs. And then I may want to go as far as to say, let me drill down and see who's coding them. Because maybe the coder is not doing their job. They're not as accurate and have as the highest level of integrity that they could. Or maybe we even want to go down and see attending provider. Who's attached to these? Where do I need to go? And it's going to get me down to that attending provider. So point being, folks, is in order to learn from your external audits, you're going to need this information at your fingertips. Another one I really like is at-risk dollars trending. You're going to have the ability to trend. So what I'm able to see is my external audit volume very low, except for this month. I like to see this going down, but what the heck happened here? And I can drill down and say, who was this? In that month, had a bunch of people sending me external audits, but this one is just killing me. So there's a lot of information on who's requesting it of you, because you need to know that. I think more important than that is not only who's requesting, but what are they targeting? So again, these are all pre-populated once you start doing external audits. But let's look at why you're being targeted. So I can right over here see these are all the people targeting me, but I could click and see, let's see. Okay, lot coming from this one. Let's see what a Humana looks like. And what are they targeting? I can see that. I can even get to specific DRGs. I'm getting a ton of external audits for this DRG 138. And again, same thing to be able to drill down to Brown requester. And I get to understand who is that. And I know that it's Meridian, but I'm also getting them from these two folks. And this will get you down to CPTs that are being audited and by whom and all of that. And again, this is not anything you have to populate. This comes from just doing what we did previously. Those are targets. And then what we need most importantly is results. Someone is going to come to you and say, are we refunding or are we retaining? And that's where you have it here. Very easy to go in here and say, let me check for you. We refunded 71%. We retained 28. Not too good here. But we're having the insights to improve. We know why we're being targeted. So I'm going to drill down again, and we can go again, facility. Which facilities had the refund? It was all coming out of this facility. So a lot of information in here through what we call audit insights that, again, give you those insights to understand specifically who's targeting you, why, and what your outcomes are. And if you can drill down to root cause, like we're showing you here, you're going to get the insights you need to turn the ship around and become more successful with these external audits. One last piece I'm going to show you is another part of AI. I may not, let's say I'm this, VP of Rev Cycle or Rev Integrity, and I just don't have time to come in and drill down, or I just want to see outcomes. This is a part of the platform you can ask a question in plain English and get the data returned to you immediately. It's called conversational AI. I don't have to learn a Tableau or a business intelligence language. I'm just going to go in and you can see I've typed in stuff already. I'm going to go in and say, what were the total refunds by facility last year? It remembers what I've typed in before. And I'm basically asking, where were those refunds coming from? Plain English question. And right away, it's showing me that I've got 2 facilities. I may have had 200 facilities, but it's showing me they're all coming out of this facility. Again, I can drill down and say, all right, that's great. But who were the, I'm going to say, again, the requesting organization. And it's all coming from United Payer Cotivity. And again, that ability to drill down and see anything I want, DRGs, who coded the services. At the end of the day, you're going to need to use this type of technology if you want to ask quick questions and build your own dashboards. We showed you many that we provide out of the box, but you can use this same conversational AI to build your own. I'm going to do one more. What were the total at-risk dollars by requester last year? I know that was one of the ones we've already created, but I may want to come in quickly and ask that. It's using AI. And right away, I now know direction and magnitude. A lot of people asking me for information, but this one is by far the most. And that ability to drill down as to why, what they're targeting. This is also a piece of information you need, is self-service and sufficiency through conversational AI. So I have one last thing to show, and that is, and I didn't show it when we were in there, but I'm going to go and do a search. And if you just want to bear with me for a second, I want to show you one last thing that I didn't show, but I think it's appropriate to show it at the end, is ESMD. So again, that means the electronic submission of medical documentation. We already went through document management, Smart Scan AI, case list, where it lists out all of your accounts after they've been scanned, everything you need at your fingertips to really maximize outcomes. But one thing I'm going to show here is the ESMD dashboard, because I want you to see that as you're sending things out, we'll be able to show you, was it acknowledged? Is it pending? So you'll always have the status. And one thing I'm going to show you here is I'm able to go in to that document management section and track submissions. So again, I'm seeing CMS acknowledged. This is pending. What was pending? It was a response to an ADR. But I can also here create a submission. Anything you store in document management in our platform, can just click it and send them. send the document. It will know that it's going to this review contractor and send it to them automatically. That's a very high level, but I've been talking a lot about ESMD. But if you've got Smart Scan AI and all these things, but not ESMD, you fall short. So point being is our MD Audit platform really has all of the technology you need to not only ingest those demand letters, but respond to them in a timely manner, which then again organically increases and naturally increases the amount you can retain. So that's really where I wanted to stop. I'm going to pull up my presentation again. One of the things I wanted to mention before we go into questions, and I'm hoping you can see my screen still, is we talked about a lot of outcomes from the MD Audit community. Good news is we have a 2023 benchmarking report coming out in November. This is showing everything anonymized, aggregated, but anonymized data of our MD Audit community. Basically saying a lot of what we talked about, what's being externally audited the most, billing compliance, revenue integrity, and coding insights. Everything we're seeing within our community, what's being denied most, why, how to fix it, all of the things that we want to provide to folks comes from this benchmarking report. And we will keep you posted. You're on our list because you attended this webinar, so you can get a copy of this benchmark report. What I want to do now with the time left is just go into questions. So Joy, I know that there's some questions. Can you just feed those to me, please?
Sure. Thanks, Dana. Great job today. First question is, how often does the system update the reporting on audit targets, audit outcomes, etc.?
Okay, so that question is specific to the reporting. So when we show audit targets, who's targeting you, why, outcomes, that was that audit insights part that we show with the data visualization. That gets updated daily. So as you're responding to external audits and saying this was approved, this was denied, all of that information is getting updated daily. So you have a real-time, essentially almost a real-time understanding of how you're doing. So that would be daily.
Great, thank you. The next question is, when medical records are sent back via task, do the records get attached at the individual claim level?
Yes, they do. That's a great question. So if I send a task, if I'm managing the external audit process and I send a task to somebody to attach medical records, the system has the intelligence to attach it to the actual that actual claim. So if I've got 7 different account requests, that medical records person providing the records has the ability to attach it to the claim that it applies to. So it can absolutely, they don't have to do a lot of navigation. It'll let them know exactly where to attach it at the claim level.
Okay, thank you. And the next question is there a way to tag claims in my Epic system with the financial outcomes from the external audit? Like refund needed plus refund amount, retained amount.
Okay, so that's a really good question as well. So it comes up all the time. You're going to be doing a lot of work in the MD Audit system, tagging claims with what you need to refund, what was retained, etc. That can be, we are right now at MD Audit, we are working on an outbound API. A lot of you will know what that means. Some of you won't, but an outbound API that takes that information and brings it back into your host system. So that the long and short answer to that is yes. I just want people to be aware that not fully baked right now. We're working on it. And it also requires someone on your side to be able to accept that inbound API. And that's more of a technical conversation. But at the end of the day, yes, we're able to get that. We will be able to soon get that information back into your, let's call it your source of truth billing system, whether it be Epic, CERN, or whatever it is. We understand that you need that information in the source of truth system.
Okay. And then the final, and before I ask the final question, I'm just going to let everyone know I'm going to launch a poll for you all just to complete. And this just helps us to plan for future webinars. So your feedback is greatly appreciated. And the final question is, can I use this to track denials and appeals as well?
Okay. This system is the core competency of what you saw today was to respond to external audits. So I wouldn't, in all honesty, I wouldn't suggest using this platform or this capability to respond to denials. That said, it seems like a natural fit, but it's more for external audits. That said, for the person asking it, we do have an entire part of the platform that we didn't show today that helps you understand root cause of denials, helps you drill down to carcs and rocks immediately, and gives you a lot of insights as to what to appeal, so you can have a better return on investment on those appeals. So we can get back to you on that part of the platform that would handle that situation specifically.
Great, thank
So
you.
folks, yeah, so folks, I think what I'm going to do is we're going to end the webinar. But again, we're going to give you about another 30 seconds to just enter the poll. But we appreciate your time coming today, and definitely let us know about future topics you'd like to see. And finally, this was a webinar sponsored by MD Audit.